For this episodes of Rona Rounds, I just wanted to put a little plug in for Brianne's Bootcamp. In the past few weeks, many of you guys have asked a patient marching back and forth down the hall, obviously with a mask on and their hands sanitized, if they're lost, only to have me pop out of the cove and yell, "It's okay, I told them to." No, I'm not actually running some weird kind of boot camp, although it is a good business idea. Many of the patient pathway protocols that have come out of Italy, US, and Canada utilize a post-exertion SpO2 monitoring to help determine a patient's disposition. Some models use a cutoff, for example, an SpO2 of 90%, while others use a delta value, for example, if the SpO2 drops by more than 5%. There's a complete paucity of evidence for these 2-minute walk tests, specifically for COVID. However, it has been utilized in some clinical guidelines and risk stratifications for PEs. The idea is that we are trying to bring out any post-exertional hypoxia. Obviously, this is kind of aimed at patients with normal cardiopulmonary systems and would not work well for patients who cannot physically walk or patients who have low SpO2s to begin with. Many guidelines use these walk tests for discharge instructions as well, especially since many patients with COVID don't feel short of breath despite being hypoxic. Upon discharge, they'll recommend that patients complete a 2-minute walk test with SpO2 monitoring at least twice a day. Patients who have blood pressure monitors at home likely have SpO2 monitoring capabilities as well. Some stores still have SpO2 monitors in stock. For example, you can find some on Amazon for as low as $45. Interestingly, Fitbits actually have SpO2 monitoring capability that was just enacted in January. So Fitbit Charge 3, Ionic, Versa, VersaLite, and Versa 2, made after 2017, all have the ability to monitor SpO2, but does require you to enable it online. So next time you see a patient pacing down the hall, running down the hall, doing squats, just know I'm not actually trying to start Brianne's Biggest Loser Sturgeon Edition. It's just to see if I can bring out any hypoxia. You might also hear patients rapidly counting to 30 in a single breath. This is aimed for patients who do not have the physical capability to walk for 2 minutes. If you want more information on this, just check out the ROTH score, ROTH. Just wanted to share a little bit of the methods behind our madness you might see happening around the sturgeon.